Let's go.
Hey babes, welcome back to my channel. I know I look a little different. I need to wear my glasses because I did a previous video, I don't know if you've seen, of the contacts review, first impressions or whatnot, and it kind of irritated my eyes. So if you see my eye getting a little glaze or anything of that nature, that's why. And I had to put on my glasses. So today's video is going to be a 7-month, because I am 7 months post tummy tuck. It's going to be a 7-month update so that you get to see what my results look like, and I'm going to tell you the honest to God truth about how I feel about my tummy tuck 7 months later. I'm going to give you the realness, and I'm going to give you just the pure truth. So I'm 7 months post tummy tuck. I got my tummy tuck in June on the 14th. I think it was in June, somewhere on June, in like 2 weeks in June. And like I said, when I went and got my tummy tuck, I will insert a picture. My before was reckless. My stomach was stretched from here to doomsday. I had an umbilical hernia and a 4-inch gap that you can stick your fingers in like this, and it would not close due to exercise. No matter what I did, it would not close because my stomach was just really destroyed. So here we are 7 months later. I didn't have feeling after surgery. I do have, I will say 50% of my feeling has come back. I have not, this is gonna get on my nerves, I have not 100% gotten all of my feeling back in my stomach. So there is some tissue that I can't still feel, you know what I'm saying? I still do have loose skin and saggy skin. I will show you what my stomach looks like now. I'm going to give you the truth and the honest to God truth. I did talk to my doctor last month, at the ending of last month, a nurse of his, and I did tell her about my last discussion with you guys about the loose skin and then the little indentation of where the incision is, where it looks like no tissue is there. So she did tell me that that was normal, and for what I went through with my babies, it definitely was going to be normal to have loose skin even after, more loose skin even after having my surgery, and that I was going to have to come back for something that I think is called is a mini tuck, but it's not. It's like, you know, stretching the skin to tighten the skin. I'm going to have to come back for that, and that's kind of like more money, so I don't feel like doing that right now. But she said I can come back in like a year, and I'm almost hitting that year mark of after surgery, almost. And I don't want to go back for another surgery right now. If I were to go back for another surgery, definitely wouldn't be for that, just not right now. And she said it's just normal. What I would do is, you know, do certain exercises to kind of minimizing the continuation of the stretching loose skin. So, which I do every now and then. I'm being honest. Every now and then I do exercise. I've started using a coconut oil and a coffee scrub. I still have stretch marks, but not as bad as they were in the beginning, which I am very happy about. So my stretch marks are kind of fading, but I still have that hyperpigmentation in the middle of my stomach where I was stretched out the most by my last child. So I'm going to show you right now what my stomach looked like so we can you can get an idea. So I got to stand. So forgive the ugly pants. This is the realization. I just took my girdle off, and I have not moisturized my stomach because I just want to show you guys what my stomach looks like post 7 months. So this is off from my girdle. It'll be gone by the end of the day. So this is what I look like from the side. This is my scar it's fading. I will tell you in a minute what I use. So, but like I said, pay no attention. This is my stomach, the loose skin. I still have a pudge here and, you know, all that good stuff. My scarring, because I know a lot of people are going to ask, a lot of people tell me that my scarring looks good for it to be 7 months post. And what do I use? I use Mederma's gel, scar gel, and I've been using it for 7 months straight. And will I say it works? Yes, because if you actually look back to my previous video, my scar was a lot darker and it was a lot of protruding. It looked like almost like a keloid, like a long keloid, and I didn't like that. Thank God, after using the Mederma nonstop, it does not have that keloid feel. It does not look like a keloid, and it is not puffy and protruding, and it's not as dark as it was in the beginning. Now, my stretch marks, like I said, as you can see, we are starting to get a little less hyperpigmentation around them. I did start doing a little derma rolling. Will I say it has an effect? It does. But one thing about that, I will say wait until you're a year out before you start derma rolling. And there's a reason for that. Not saying that that caused any extra sagging or anything. You just need to make sure that you don't further have an infection or anything of that nature. But everybody's different. Now, I did have itchy skin, which is normal. After surgery, you're going to have a lot of itchy skin. So be prepared for that. I have a lot of itchy skin. Like, my skin itches and I have to put oil on it. And your skin will get dry because you have to understand you had cosmetic surgery. So your skin is going to be to the utmost of dry. This is what they also don't tell you after surgery. You're going to be extremely dry. Your skin is going to be dry. So make sure that you're drinking water and moisturizing every inch of your body, from your back, feet, your butt, all the way to your stomach, or wherever you've had surgery. Moisturize. That is key. That is key for your skin to soak in the vitamins and the oils that it needs, because it's healing. It's still in the healing process, and it's still trying to, your body has a mind of its own. It's still trying to get on the right track of things and figure out things, to heal you, fully heal you. So please moisturize. This is coming from somebody personal who knows what it feels like to not go a day without moisturize. I cannot do that. Otherwise, I'm going to be scratching, and that furthers bring on the stretch marks, the continuation of dry skin and scratching. So I don't do that at all anymore. But like I said, back to what I said, I bought this coconut coffee scrub that I now use mixed with coconut oil. Mix that up and I scrub my stomach. Not scrub, but I lightly circle scrub my stomach, and it works well. It's perfect. That's another reason why you see my stretch marks kind of fading. I don't know if you see the top of my stretch marks. They used to be protruding. They're not like that. Not only that, y'all, my stretch marks no longer feel like, how some of those stretch marks, you can feel the indentation. I can't feel that anymore. It's just straight smooth skin. So I'm going to repeatedly keep doing this until I, succeed the results that I want. Kind of, prolong having to get surgery again, because I don't want to kind of do that right now. Just not right now. So if you are somebody that has or is trying to get a tummy tuck, please know these key factors. Make sure that you are following what the doctors tell you to do, which is eating right, which is exercising when you get the okay, moisturizing, drinking plenty of water, because I've noticed also after surgery, I've gotten a lot of like dizzy spells and stuff like that. So please eat right. Make sure that you are caring for your scars so that you don't have keloids and all that other stuff, because that is real. Keloid scarring around your incision is definitely real. Make sure you are using a sunscreen. If you're going to be out in the sun during the summertime and you just had surgery, you're still going to need sunscreen, because their hyperpigmentation is real. So sunscreen, and make sure you are moisturize, and make sure you are taking care of yourself hygienic wise, skincare wise, exfoliating, but just not heavily and not every day, but make sure you're doing it. These are the things that a lot of people will not tell you, and if they do tell you, you sometimes don't follow. You need to follow. So after 7 months of my results, do I love my results? I love what they look like compared to what they used to look like, okay? That's the truth. Compared to what my stomach used to look like, yes, I'd say I love my stomach. Do I feel like my doctor could have done a better job for the price point? Yes, I also think that, because a lot of people ask, my surgery was expensive, and for the price, this is why I tell you women to go in there and demand that your doctor does exactly what you say, even if he's telling you don't get the high expectation of walking out of here looking like J-Lo. Tell him I want to look like something close. Make sure that you're satisfactory guaranteed, because you're spending money out of your pocket to put into their business. So make sure you're going to a doctor that actually cares and loves for not only what he does, but his patients as well. Because my doctor, like I said, my doctor was not a frenzy type of person. You know, he's friendly, but he wasn't, you know, the type of doctor that, you know, I felt like was like one-on-one care, because like I told y'all, I didn't see him after my surgery and my checkup. So I like to see doctors one-on-one, face-to-face, to get the realness, and not these nurses that will tell you, oh, this is normal XYZ. No. So if you want your doctor to be there A to B from beginning to ending, make sure you tell them that up front, because you're spending your money. They're doing the procedure that you're spending your money on. So another person asked me, will I do the surgery update to tighten the skin? Yes, I will do that, but that will be in the future. Not right now, probably a few years from now. I'm giving my body time to recover and recuperate. So I'm not doing that surgery right now. But if I choose to do a surgery, it just won't be right now. But I will do that definitely skin tightening, because I feel like my skin can now tighten to where it will give me that look that I want. My belly button. My belly button is, that's the only thing that kind of irritates me, that I miss about having my old belly button. I'm talking about my pre-pregnancy belly button. It was really cute. And it looked really cute. Now my belly button, it kind of looks deformed to me, and it just doesn't look natural or kind of normal to me. But that's all right. They had to take what they could give. They had to give me exactly what I can get at that time. You know, because with 3 babies and stretched skin, my belly button was like almost non-existent. So I am satisfied with what they could do, what he could do. But like I said, I just would recommend you ladies to go to somebody that you trust. Go to somebody that's hands-on with you and that makes you feel like family, that makes you feel like you're in the right hands. Now, I'm not going to say that I was not in the right hands, because I was. Now that I look at his work, I'm starting to see that a lot of women are getting the same looks. So I am glad that I look natural, okay? I look natural. My tummy tuck is natural. You won't see it on his website or anywhere on his IG, because I don't feel like he cares to post, you know, those type of real results. He's only posting perfection. So I'm showing you. If you don't know, I went to Dr. Curves to get my tummy tuck. Will I recommend other people to go to him? I will only recommend you to go to him if you don't have stretch marks and loose skin extremely like I did, if you've seen the picture before. Only go to him for that. But if you're a mother that, you know, you're seeking for better results, I say go to somebody in Miami who's trustworthy, not who's doing it in the alley. Go to somebody professional in Miami that cares for not only you, but what they do. I'm sorry, y'all. My allergies are getting to me. So, let me see if I summed everything up. I think I summed everything up. If I'm missing anything, I will definitely come back with my 8th month, update, but I'm glad I was able to show you guys my stomach. This is the realness. This is the real me. If you like it or you don't like it, that's okay. A lot of people is like, you know, for this work, you should have got X, Y, Z. I didn't get the lipo. There was a reason why I didn't get lipo, because I didn't want drains. And I have 3 kids. And around that time, my kids were with us as I was recovering in Atlanta, Georgia. So I didn't want that further hurdle, because I was already feeling helpless. So if I had to tell you to choose to get lipo, get it. If you don't have kids around you where you can recover at a nice pace, do it. Will I think about doing lipo in the future? Yes, you know, around my little sides and stuff. But other than that, I can just kind of work that off, exercise and eat right to get that gone. So I'm not worried about that. But as far as my overall experience as a mom of 3, somebody who's struggled heavily with body issues, I am heavily still insecure about my body, even after my surgery. I'm being honest, but I am more confident now that when I wear a bathing suit, I still can see that one, my body did something amazing. I gave birth to, beautiful children. It's beautiful the way it is, and it was in the beginning. Do I have a little boost of confidence after surgery? Yes, I do. I have a whole lot of it because I am snatched. If y'all can see my pictures on IG, follow me at Tamika_Moscato. You'll see. My waist looks snatched. Everything looks good. I'm not gonna lie, with clothes on. Now, will I say I have this confidence without clothes? Yes and no. And it's a yes and no because, I struggle with that up and down of, wanting to fix the imperfections, every last one of them. But if I keep doing that, I'll drive myself crazy. So in all actuality and realness, I still struggle to love myself even after having surgery. So this is why I'm going to tell y'all, don't think that surgery is going to wipe away all of those feelings, because it won't. You're still going to feel some way about something in particular about your body. So don't go in to surgery thinking that it's going to magically erase everything. For some women, it does. That's just genetics for them. And for other women, it doesn't. And that's okay. It's okay to feel vulnerable. It's okay to feel insecure about certain things, even after having surgery. It's okay to have second thoughts, even about your surgery after you've had the surgery. You know what I'm saying? It's okay. It's normal. So, to sum everything up, I kind of do appreciate my body now, but I definitely appreciate my body before, now that I look at my now. But if I had to tell any mom who wanted to get surgery, make sure you have a great support system behind you, and make sure that this is actually what you want to do. This was no walk in the park. It was not. It was 4 months of antagonizing pain, still trying to push past, because I took pictures probably about my 4th month, and I was still in pain from my scarring. It's going to take a while for you to kind of get back on your feet the way you should, but make sure you have a great support system, and make sure that this is actually what you want to do, and the results that you're going to get are realistic. So, yeah, y'all, I'm done ranting and babbling, and I will be back with my 8th month update. And we shall see how the creams and everything worked out. So it's been fun. It's been real, and I shall catch y'all in my next one. Bye.